A new report from the U.S. Department of Health and Human Services suggests that there are health side effects after exposure to chemicals like GenX. Their Agency of Toxic Substances and Disease Registry have released the findings, and our Andrew James was able to spend all evening breaking those findings down. What did you learn, Andrew? He joins us with more.
Well, Amanda, we were learning that these reports are gathered hundreds of studies. In fact, they put them all together and concluded exposure to PFOA as well as sister chemicals can lead to a host of possible health effects, from increased risks to thyroid disease to even some forms of cancer. It was an answer people in the Cape Fear wanted from the moment we found out GenX was in our water. A 650-page draft report from the Department of Health and Human Services cites several studies suggesting increased risks for disease and defects from PFOA contamination. The report gathered hundreds of studies surrounding chemical compounds like PFOA, which is the more formal term for GenX. Studies in particular looked at high contaminations and lower level contaminations from the people who live in West Virginia in the fallout of the C8 discovery and class action lawsuits against DuPont and their Washington Works facility. The studies analyzed more than 69,000 people, some with GenX exposure of 1 part per billion and others at 423,000 parts per trillion. Studies showed chances in testicular cancer and kidney cancer as a result of contamination. The report also listing liver damage, increased risks of thyroid disease, asthma, and decreased fertility from exposure. The Cape Fear Public Utility Authority issuing a statement after the report was released saying, quote, "We are currently working to understand its findings and their relevance to PFAS levels in the finished water of the Sweeney Water Treatment Plant. We have also reached out to ChemWars for comment, but have not heard back." Now, I did happen to hear from lawyers involved in several locally originated class action lawsuits surrounding GenX contamination focused at DuPont and ChemWars there. Now, they told me in part, quote, "It confirms the numerous health risks of exposure to PFCS like GenX and also suggests that we need to consider the cumulative effects of exposure to this family of chemicals." Now, the firm went on to say the report suggests the state health goal for GenX should be as low as 10 to 12 parts per trillion, but I'm still waiting to confirm that that is actually the case. Amanda?